Now, looking at matters health, did you know that leukemia is the most common cancer that kills children in Kenya today? 9 in every 10 children diagnosed with cancer in Kenya die from the disease. Our health reporter Irene Galgalo explores why this is so and what the government should do to make sure there are reduced cases of cancer in Kenya.
It is estimated that cancer causes more deaths than HIV, tuberculosis and malaria combined globally. 70% of the global cancer burden is found in low and middle income countries like Kenya. If detected early, 30% of cancers are curable. However, 80% of cancer cases are diagnosed in late stages. In Kenya, cancer claims the lives of every 7 in 10 children diagnosed with the deadly disease. Dr. Modoni Mboro, a resident pediatrician at the current hospital, explains why this is so.
The most prevalent cancer in children are the leukemias. They carry about 60% of the total burden of cancer disease in children. There are other solid tumors that we also see in children, which are the kidney tumor called nephroblastoma, there is neuroblastoma, and there are others like rhabdomyosarcoma and osteomyosarcoma. Those are the solid tumors that affect either the kidney, the adrenal gland, the soft tissue and the muscles, and the bone respectively.
Cancer is the third highest cause of death after infectious and cardiovascular diseases in Kenya, with more than 27,000 deaths per year. Childhood cancer accounted for 15% of cancer admissions at Kenyatta National Hospital between 1998 and 2008, with 1 in 10 children surviving cancer in Kenya compared to 7 in 10 in the developed countries.
Patients don't show up early enough for us to be able to make an early diagnosis. Early diagnosis covers more than 60% of the prognosis, because if we discover the tumor early, we start treatment early, and there's success.
A lack of consistency in keeping appointment dates for cancer treatment is also a factor that most doctors grapple with. This is compounded by an unavailability of drugs in the country's hospitals.
No availability of drugs, consistent availability of drugs. And because of that, some patients miss their courses of chemotherapy when they're supposed to get them. And because of that, there is no way we can tell which way the tumor may go. Because we were supposed to give the course of chemotherapy after 3 weeks of therapy, and we give it after 6 weeks. There's already the time lapse.
Many Kenyan parents are spending billions trying to find treatment for cancer in countries like India, South Africa and Dubai. Dr. Mboro says this should not be the case and that the government should assist in coming up with legislations that favor those who suffer from the deadly disease.
I think the government needs to come in and make such policies that cancer treatment is free. Because we've seen that's where we grew from HIV treatment. HIV medicine several years ago was not easily available and was not free. But today, HIV medicine is free. And many patients have been able to live a longer life thanks to the government even just making that policy that they will get HIV medicine for free. Cancer is one of the major killers, not only for adults anymore, but even for children. And if the government may be able to provide just drugs and the human resource to be able to take care of these patients, I think we're going to have a great success.
The government is encouraged to increase the number of free diagnostics and treatment facilities in the country so that quality treatment for cancer can be accessed locally. Reporting for WTV News, I am Irene Galgalo.